Let us look at the female reproductive system. Now, when you begin the chapter, always the first thing first is go through the index. Just take some time to observe how the codes are divided, what are the different code range, and then the procedure. And this is an excellent diagram of the female reproductive system where all the organs are given. And then the labeling is at most detail. So there are many diagrams which are available, but I found this which includes most of the important parts and of the female reproductive system. So the female reproductive system, it is the complex network of organ which is responsible for the reproduction, hormonal balance and fetal development. It consists of both primary sex organ like ovaries and then the accessory sex organs such as uterus, fallopian tube, cervix and vagina. The external genitalia, which includes the labia minora, labia majora, and clitorius. And what I have done is when I'm giving you this CPT coding, I have tried to cover the important anatomy in the shorts. So kindly look at them as well. I have tried to cover certain medical terminology which are important as far as the female reproductive system is concerned, and it will definitely help you to understand the case better. And so we will go one by one. They are arranged in the alphabetical order. So antenatal is pertinent to the period before the birth, and opposite of that is a postnatal, that is after the birth. Dysmenorrhea, when we say dys is something painful, dysmenorrhea is a painful menstrual cramps during the menstruation. Ectopic is a pregnancy occurring outside the uterus, usually in the fallopian tube. See, the fertilization happens in the fallopian tube, and then the zygote comes and get attached into the uterus, and where the further development happen. But sometimes that after fertilization, the zygote remain inside the fallopian tube, and that is called as ectopic pregnancy. Endometriosis, growth of the uterine leg tissue outside the uterus causing the pain. Endometriosis means the endometrium, the innermost lining of the uterus. The cells from that, they are not only present in the endometrial wall, but sometimes you will find them outside the uterine wall also, and that causes the pain during the menstruation. Microcephaly is a small head, while macrocephaly is a larger head. Multipara, it is a woman who has given birth to two or more times. That is, more than one is multi. The neonatal is related to the newborn, especially the first 28 days. Nullipara is woman who has never given birth. And then the polycystic is having many cysts. Poly means many, cyst is the sac. So polycystic is many cyst, often used in reference to the polycystic ovarian syndrome or polycystic ovarian disease, PCOD. Postpartum referring to the period after the childbirth, and preterm is the baby born before 37 weeks of pregnancy. So all these are very important terminology. So there are some more terminologies which are here, and kindly go through that. Myoma, which is nothing but the muscle tumor. And then we have oophorectomy. Very commonly we see this terminology related to the female genital system, that is removal of the ovaries. And salpingectomy. Salpinge is basically a tube. So whenever we use the word salpingectomy is removal of the fallopian tube. Then vaginitis is the inflammation, because we know the word itis is the inflammation. So if it is a cervicitis, it is the inflammation of the cervix. Then scopy is a viewing. So if I'm viewing the vagina, it is called as a colposcopy, and if I'm viewing the uterus, it is called as a hysteroscopy. Episiotomy is basically the surgical cut of the vulva. And episiotomy is usually done during the childbirth. Then gynecology is study of women's health, and obstetric is study of only the pregnant uterus. So pay attention to that because all these terminologies are asked repeatedly. So let us look at the vulvectomy. It is nothing but the surgical removal of the vulva. Now, if you see the vulvectomy codes, they have used a particular language, whether it is a simple, radical, partial, or complete. And simple is nothing but a removal of the skin and the superficial subcutaneous tissue. While the radical is removal of the skin and the deep subcutaneous tissue, it is usually carried out whenever the patient has cancer. So along with that particular part, we try and remove the adjacent, the structure, mainly the lymph node also. Partial is removal of less than 80% of the vulvar region, while the complete is removal of greater than 80% of the vulvar region. So kindly pay attention when you are solving the questions related to vulvectomy. So let us look at the first question on the vulvectomy. Vulvectomy is performed on the female patient diagnosed with a vulvar malignancy. The gynecologist oncology surgeon takes skin and deep subcutaneous tissue from approximately half of the patient's vulva as well as her inguinofemoral lymph nodes bilaterally. What are the CPT code for this scenario? Now, from the previous slide, we know that the vulvectomy is, divided depending upon what you are taking. And here they have clearly said that it is a removal patient's vulva has been removed, and it is a deep skin and the deep subcutaneous tissue has been removed. Now let us look at our code. The code is 56620, 630, 631 and 632, and we need to read all the code language before zero downing the code. So go through all this code and tell me the answer. So after looking at all the code, D is the correct answer because 620 it talks about only vulvectomy simple, and 630 it talks about a vulvectomy radical and partial. But you can see there are two indented code which talks about the inguinofemoral lymph node removal, and that has happened. Lymphadenectomy happened. And if you observe the code, 3.1 talks about unilateral, while 3.2 talks about bilateral. And in the encounter, what happened is it was a bilateral removal of the inguinal lymph node. So D is the correct answer, pretty straightforward, and we will zero down the answer. So let us look at the next question. A patient underwent a bilateral vulvectomy with a removal of 92% of the vulvar area. She also had an inguinofemoral lymphadenectomy during the same operative session. What codes capture these services? And we have these options here. So what are the data points here that vulvectomy happened? In that case, the removal of the 92%. And if you remember, if the area is more than 80%, we considered it as a complete vulvectomy. And since it's a lymphadenectomy also, if you then in that case it is a radical, because whenever we do the radical excision along with the surrounding structure tissue, we also try and remove the lymph nodes, and that is very very important. And when that happens, then we call it as a radical. So here that is important consideration. And you see the code 56637, it is a vulvectomy radical complete, and with the bilateral inguinofemoral lymphadenectomy. Then 3.2 is a with a bilateral inguinal lymphadenectomy, but it is the indented code for the vulvectomy partial. And 56625 is a vulvectomy complete. Okay, so I have given you enough clue. Let me know the answer. So option B is the correct answer, 56637, which talks about the vulvectomy radical complete and with a bilateral inguinofemoral lymphadenectomy, and that's what happened in the patient case. And remember, when the language of the code includes the word bilateral, there is no need to write the modifier 50 separately. So option A goes away 6632. It is bilateral linguinal lymphadenectomy, but it is for the partial, and this is complete. I mean, it does talk about the complete vulvectomy, but it doesn't include the lymphadenectomy, and in our patient case it has happened, so B is the correct answer. Now let us understand the maternity care services. If you look at it, it is of three types. Antepartum care, it focuses mainly on the health of the mother prior to the baby's delivery. Then the intrapartum care, it covers the support and medical care during the labor and the childbirth. And the postpartum care involves recovery support for the mother and the newborn after the birth of the baby. So these are the three important care. Now, if you look at the codes, these are the code for the vaginal delivery. And if you look at the code, this is the 59400. It talks about the complete package because it includes the antepartum care, vaginal delivery, and the postpartum care. While 59409, it includes only the vaginal delivery. While the 59410, it includes the vaginal delivery and the postpartum care. So pay attention to the language of the code, that along with the delivery, what care it is included. And the same goes even for the C-section. So just in your book, just go through the code and you will see that exact same language they have used for the C-section, except instead of vaginal, they have used for the C-section. Now let us look at the childbirth. How did it happen? If it is by vaginal delivery, we have this code range. If it is by cesarean delivery, we have this code range. And if vaginal delivery after previous cesarean section, then which is more commonly called as a VBAC, that is vaginal birth after C-section, we have two categories. It could be the successful attempt, that means the first C and the second vaginal, but it could be unsuccessful also. That is, the first was cesarean section, second they tried with vaginal, but they had to do it by C-section. So whenever you are, coding for that, pay attention to all these details for the correct coding. Now I want your complete attention. See, whenever there are twins, then how do we code it? If the lady has twins and both are delivered vaginally, then we write two codes because there are two babies which are born. So for the first baby, we write this code 59400. What is the code description? Routine obstetric care. Obstetric care means at the time of delivery. Okay, and this is the code for the first baby, and for the second baby, vaginal delivery only. So for the second baby, we will write this code. Remember that this is a very important thing because this question has been repeatedly asked, and nowhere in the book it is given that you have to write this code for the second baby in the twins. Okay, and we put the modifier 51. Okay, so this is for the twin vaginal delivery. But suppose if the lady has twins, first was delivered vaginally, and then the maybe in the second baby there was something happened, the baby, his heart rate was more, or he wasn't breathing, and they had to immediately go for the C-section. So the first happened by vaginal, second happened by cesarean. Then in that case you will write first code for the cesarean delivery and second code for the vaginal. Remember, the RVU decides which code goes first, because in this case actually what happened, the vaginal delivery happened first, then C-section, but depending upon the RVU, we write the C first and then vaginal. So let us look at this question. A 27-year-old woman delivers a twin by her regular obstetrician. The first is delivered vaginally, but the second is delivered by the C-section. Both are delivered without complication. Patient will return in 2 weeks for the postpartum care. What are the CPT codes? So let us collect our data. What is the data here? The data is the lady delivered the twin by her regular obstetrician. Means, see, when they write that, it gives you one more clue that that particular obstetrician has taken care antepartum and the intrapartum also, and the postpartum visit is yet to happen. So it's like a regular obstetrician. Now this is a twin delivery, so we cannot have a one code. So option C goes away because we have to code for both the babies. So option C goes away. And what is our guideline? That if it happens like that, one twin, the twin are born, one by vaginal, one by cesarean. So we code the cesarean delivery first, followed by vaginal. So keep all those things in mind, collect the data and tell me the answer. So yes, D is the correct answer because 59510 is a routine obstetric care including antepartum care, cesarean delivery and postpartum care, because this is a complete package. Postpartum is yet to happen, but since it's a regular obstetrician, 59510 is the cesarean section. And what is the second code? Now the second code is important because the second code we cannot code this. We will have to code this vaginal delivery only with or without episiotomy and or forceps. So here it is for the second baby. Second baby we cannot write this code. We have to write this code. Remember that. And we will put the modifier 51. So let us look at the next question. What code series would you refer to for patients who have had a previous cesarean delivery and now present with the expectation of the vaginal delivery? Go through this diagram, pretty easy for you to zero down the answer. So yes, D is the correct answer, which is 59610 to 59622. See, because here they have just given you the scenario that first cesarean and then the second vaginal is what the doctor is doing. But they haven't spoken whether the outcome was positive or the negative, that is successful or unsuccessful. So we have to cover the complete series. So this and this B and C is not the right answer because it is giving you whether it is a successful and unsuccessful. And we are not even looking at that. We are just looking at this scenario. Okay, we back scenario, and that's why D is the correct answer. Now let us look at certain biopsy codes. The biopsy codes, as far as the female genital system is concerned, they are mainly for the specific site of the biopsy where the biopsy has been carried out, whether we carried out in cervix or ovary or vulva or endometrium. And while during the biopsy have we done the dilation. So that is an additional consideration. And whether it is a separate procedure, because sometime we have to code it as a separate procedure, but sometime it is uh, it is the part of the major procedure. The complexity of the procedure is also important consideration. And here there are certain codes which are given. So you will see that the code varies depending upon where the biopsy has been carried out. The code has the language like without cervical dilation, with cervical dilation, all those things. So pay attention to all those words because that will decide your code. Now let us take the next question. Cheryl, a 36-year-old established patient with Dr. Win, an OB GYN. During Cheryl's annual physical examination, Dr. Win noticed a lesion on the perineum. After completing the annual exam, Dr. Win biopsies 5 lesions on the perineum. How should his office code the service for the biopsy? So first thing first, it is where the biopsy has happened. The biopsy has happened at the perineum because that is an important consideration. And then we need to find out how many lesions. So there are 5 lesions that has been biopsied. And when did this happen? This happened during the annual physical examination. Now, the last is how should his office code the service for the biopsy? So, we need to code for the biopsy. So, these are the important data point that we have collected over the encounter. So, let us see what are these code. So, 56605, it is a biopsy of the vulva or the perineum, first lesion, and 56606 each separate additional lesion. So we have 5 lesions. So we will require one code, and this is the add-on code, and that we will require 4. Now if you see all the options, there is one very wrong option. Can you tell me what is that option? Option C, because they have put the modifier 51 on the add-on code, and that is absolutely strictly no-no. So you can eliminate that option. So that remains with A, B, and D. Now D is also not the correct option because what they have done is they have written the add-on code twice and they have put the modifier 59. This is not the way we write the code because it is for the first lesion and additional lesions. So D is also not the correct option. So in between A and B, tell me what is the answer. So yes, A is the correct answer, not the B, because why? They have, how should his office code the service for the biopsy? They have not told you to code the complete visit. They have told you to code only for the biopsy. So pay attention to the question very carefully. Now let us look at the next topic, and that is abortion. Now here I have tried to give you the definition of the various abortions because sometimes they have asked this in the anatomy and medical terminology section. So what is spontaneous abortion? The spontaneous abortion is the natural loss of pregnancy, and the important time period is before 20 weeks of gestation without any outside intervention. It is the medical term for miscarriage. Then the missed abortion. A missed abortion is a type of abortion, spontaneous abortion, where the embryo or fetus has died but the body does not expel the pregnancy tissue. It is called as a missed because the woman often has no symptom and is unaware of the loss. That is called as a missed abortion. Then the complete abortion, it occurs when all the pregnancy tissue or the product of the conception is fully expelled out from the uterus. And incomplete is occurs when some but not all of the pregnancy tissue is expelled and some remain inside the uterus. And I have tried to give shown you in the diagram. This is the incomplete where some of the product of conception remained inside. This is complete where you can see the uterus is completely empty, and this is missed where the fetus is dead inside, but the lady does not have any symptom. Now let us look at the code for the abortion. So if you see the code for the abortion, it lot depends on how the abortion has been treated and whether it was a complete or whether it was a partial. All those things we need to take into consideration, because if it is a spontaneous abortion without intervention of any surgery, then we can write an ENM code. But if it is a spontaneous abortion treated surgically, then the code is different because it is incomplete and we will have to intervene. And if it is a missed abortion, then the trimester is also important consideration. Septic abortion means whenever abortion complicated by the infection. And induced abortion is whenever we have induced it by the external means like a dilation and curettage, dilation and evacuation. And nowadays there are certain medical vaginal suppositories that are given an intraamniotic injection. So as a coder, please pay attention to all those things to pick up the correct code. Okay, so Dinah suffered a spontaneous, incomplete miscarriage during the second trimester and required a surgical completion of this event. How should this procedure be reported? And we have this code. Kindly go through the code. 59812 talks about treatment of an incomplete abortion, any trimester completed surgically. 59820 talks about treatment of the missed abortion completed surgically, but it talks about the first trimester. What is our trimester? Second trimester. 59821 is the treatment of missed abortion, second trimester. And 59840 it talks about induced abortion by dilation and curettage. Definitely induce it didn't we did not, I mean the doctor didn't induce it. Then in between these three, tell me what is the answer. So yes, A is the correct answer. See, 59820, it is a treatment of the missed abortion. And I told you what is missed and what is incomplete. So A missed abortion completed surgically, but first trimester. Our trimester is the second trimester. 8 to 1 is the second trimester. But again, it is a missed abortion. In this case, it is a incomplete abortion and any trimester, because it doesn't matter first, second, and third. So A is the correct answer. Hysterectomy is a surgical procedure to remove the uterus and sometimes the cervix from the female genital system. Now, as far as the hysterectomy is concerned, we have the various kind of hysterectomies, and that depends on what surgical approach one has taken. Now, if it is the uterus is removed through the surgical incision in the lower abdomen, it is called as a abdominal hysterectomy. That is, we do the laparotomy and then take out the uterus. Laparotomy means cut open the uh, cut open the lower abdomen and take the uterus. Vaginal hysterectomy is the uterus is removed through the vagina. And laparoscopic hysterectomy is a minimally invasive procedure where the uterus is removed through a small incision in the abdomen using laparoscope, a thin telescope-like instrument. Now, the additional consideration about the hysterectomy is about the weight of the uterus. So if you see the codes differ depending upon the surgical approach. Secondly, even the weight of the uterus. The code differ based on whether the uterus is 250 gram or less or greater than that, and remove of the other organs. Whether that along with the along with the uterus, are you removing the tube, ovaries? That is also important consideration. Now pay attention to the type of the hysterectomies. One is a total hysterectomy where the entire uterus and cervix has been removed. So this is a total hysterectomy, or even in this case, this is a diagram of the total hysterectomy where even the entire uterus and the cervix has been removed. While the partial hysterectomy, or which is also called as a supracervical or subtotal, where only the part of the uterus is removed, leaving the cervix in a place. Okay, that's called as a partial. Well, the radical hysterectomy, this procedure involves removing the uterus, cervix, and surrounding tissue, often including the lymph nodes, and is typically used for certain type of cancer. So just have a look at all the hysterectomies so that it will give you an idea how what portion of the uterus along with the surrounding tissue has been removed. What code should be reported for a diagnostic dilation and curettage for a patient experiencing heavy bleeding that is not associated with pregnancy? Now, let us look at the data point. So, first of all, what they have done is diagnostic dilation and curettage has happened, and she is not pregnant. So, these are the important consideration when we are, doing the coding. So let us look at all the options. 58120, it talks about dilation and curettage. It is a diagnostic and it is non-obstacle. 59160, it is a curettage but postpartum, that is after the delivery. 57800, it talks about dilation of cervical canal instrumental, and then 57700, it talks about the circlage of uterine cervix non-obstetrical. So these are the options. Now if we see 59160, it is a postpartum. So and the lady is not pregnant, so that is a clue that 59160 is not the right code. 57800, it is about the dilation, but it is instrumental. That means they have done certain surgical procedure, and ours is a diagnostic. So we cannot even take 57800. So in between now 57700 and 58120, let's see what the answer is. So yes, 58120 is the right answer because it talks about dilation and curettage. It talks about the diagnostic procedure, and it is non-obstetrical. That means the when it is not pregnant, and that's what actually our patient is. Now let us take one more question. Dr. Lee provides comprehensive obstetric care to 35-year-old patient throughout her pregnancy, including regular prenatal visits and monitoring. During the labor, complications arises necessitating an emergency cesarean delivery followed by an unexpected postpartum hemorrhage that doesn't respond to conservative measure. Dr. Ree performed the cesarean hysterectomy to control the bleeding, removing the entire uterus and continue to provide postpartum care in the weeks following the delivery. Of the following answer, which best describe the encounter? So what has happened here is this gynecologist provided the antepartum care, the intrapartum care, and the postpartum care. And what happened here is they had to do the cesarean delivery, which they did, but afterwards there was a profuse bleeding, and then gynecologist couldn't stop the bleeding by the regular means, and then they had to go for the cesarean hysterectomy. So these are the data point that we have got from this particular question. So let us look at the code 59510 routine obstetric care including antepartum, cesarean delivery and postpartum care. So definitely that has happened because it is very clearly given here that regular prenatal visit, that is a prenatal is prior to birth, which is also called as a antepartum, then the cesarean delivery, and then the postpartum care also care in the weeks following the delivery. So we will require a code 59510 and it takes care of the cesarean delivery. But there is a cesarean hysterectomy that has happened too. So for which we will have to come here, and whether it was a subtotal or total, it doesn't matter. But if it happens, the hysterectomy happened after the cesarean delivery, then we have to pick up the code 59525, and yeah, and well, let us see then what the answer is. So yes, B is the correct answer because we will require a code 59510 as this same doctor did the antepartum care, the cesarean delivery and the postpartum care. See, 59514, it talks only about the cesarean delivery, but it does not include the antepartum and postpartum care. So 59510 is the code that we are looking for. And 59525, it is the subtotal or total hysterectomy after the cesarean delivery, and there is a note list separately in addition to the code for the primary procedure. And here also use 59525 in conjunction with, and this is the add-on code, so we will write the code this first and followed by this code. This is the abdominal hysterectomy that did not happen here. So we will go with the answer B. A 5-year-old female has a history of post-void dribbling. She was found to have extensive labial adhesion, which have been unresponsive to topical medical management. She is brought to operating suite in a supine position. Under general anesthesia, the labia majora is retracted and granulation chronic adhesion were incised midline both anteriorly and posteriorly. So the adherent granulation tissue was excised on either side. What code should be used for this procedure? So let us look at our data. So what is happening is the lady, this little girl has the labial adhesion, and that has been removed. And so let us look at the code 58660. It is a laparoscopic surgical, the procedure where the lysis of the adhesion has been done. Lysis means the breakdown of the adhesion has been done, and it is laparoscopy. First of all, I do not see any laparoscopy here in this particular encounter, and secondly, this adhesion is for the fallopian tube and the ovaries. Of course, it has happened to the labia majora, so that is another important consideration. If you look at the code 58740 is a lysis of adhesion. Now this is the open procedure and this is the laparoscopic procedure. And then this is the lysis of labial adhesion, and this is 57061 is a destruction of the vaginal lesion simple by laser or electrosurgery or cryosurgery or chemosurgery. So now go through all the codes and tell me the answer. So yes, 56441, which talks about the lysis of the labial adhesion, and that's what happened in our patient case. We will go with the answer D. Let us take one more question. A 22-year-old is 14 weeks pregnant and wants to terminate the pregnancy. She has consented for D&E. She was brought to the operating room where MAC anesthesia was given. She was then placed in a dorsal lithotomy position and bed speculum was placed into her posterior vaginal vault. Cervix was identified and dilated. A 6.5 centimeter suction catheter hooked up to a suction evacuator was placed and product of conception were evacuated. A medium-sized curette was then used to cure her endometrium. There was noted to be a small amount of remaining product of conception in her left cornea. Once again, the suction evacuator was placed and the remaining product of conception were evacuated. At this point, she had a good endometrial curating with no further product of conception. Noted what CPT code should be used. So first of all, the lady is pregnant and her pregnancy was terminated with the help of D&E, that is dilation and evacuation. Of course, they have used curettage in between when they saw small amount of remaining product of conception which were left. But the majority procedure was evacuation. So let us look at our option. 59840, it talks about induced abortion by dilation and curettage. And this is the case of induced abortion because they have induced it uh, from the outside. And then 59841, it is induced abortion by dilation and evacuation. 59812, it talks about the vaginal delivery only after previous cesarean delivery, and 59851, it is with dilation and curettage and or evacuation. But this is the indented code, so it is for the induced abortion by one or more intraamniotic injection. So this is the code is whenever the abortion has been induced by the intraamniotic injection, that is the by medication they have induced it. Now after going through all the options, tell me what is the correct answer. So yes, B is the correct answer because it talks about the dilation and evacuation of the induced abortion, and we will go with that answer. The curettage did happen, but it is just a procedure, but it was not a major method they have used to evacuate the product of conception. So this is my last slide, and then we will take some question answer series as well.